Welcome to Talk Ottumwa, a production of Greater Ottumwa Partners in Progress. On this podcast, we'll talk about the local businesses in Ottumwa to give you the backstory to their success. We'll also talk about the economic initiatives that are driving the progress of the community. And we'll talk about the issues that the community faces and much more. So stick around and let's talk Ottumwa. Hello, everybody, and welcome to an episode of Talk Ottumwa. Today we have a really special guest in that I'm sure that everybody in the community is probably anxious to hear from. He is the new / 1-year-old CEO of Ottumwa Regional Health Center, William Kiefer. Welcome to the program, William.
Well, good afternoon. Thanks for having me.
So I guess we'll just get off the ground rolling here. Can you provide a little bit of an update on Ottumwa Regional and where you've been and where you're at today?
Absolutely. So I joined the team here in Ottumwa. It was November of 2022, and so it's been a little bit over a year. My first winter was easy. This one, not so much.
This has been a little challenging for everybody, I think.
It's a little chilly outside, but happy to be here. And so from a facility update perspective, I would say I think everyone's aware of the significant struggles that we had in 2022, the fall of 22, related to the death of a provider. We've had significant survey activity from the Drug Enforcement Agency, from the Centers for Medicare and Medicaid Services, as well as from DIAL, which is the Department of Inspections, Appeals, and Licensing here in the state of Iowa. So lots and lots of survey activity through the latter part of 22 and into all of 23. And we had some citations, and we have worked through those, and anything related to the events of the fall of 22 have been resolved. And so we're encouraged by that. It's been a huge effort by so many people at the facility to get us to this point. And so we're excited for that. We do have some survey activity still to come in 24, but a huge chunk is taken off our plate by getting through that. So from that perspective, we're really excited to be through that. One of the other things that came as a result of this, as I've talked with some of my leaders at LifePoint, we're a LifePoint facility, and we thought, how can we turn this into a positive? And we thought we would love to do something to really make an impact on substance abuse in this community. So many of us know that Ottumwa is underserved and underrepresented in many ways. And we fight two sister epidemics in healthcare and in, I would say, wellness, which are behavioral health. We have a high percentage of behavioral health needs here in this community, as well as addiction. And so those two coupled together are really significant challenges. We see it daily in our emergency department, our facility. I want to make sure that people are aware that we have a behavioral health department, and folks can always come to the hospital, whether if they're in acute state and they need evaluation, we're here to take care of you. We have trained professionals in our emergency department. We actually access even more specialized experts through telemedicine. And so you can certainly come in and be evaluated by nursing staff as well as by our ED physicians. But if someone's having the need for more, then they just wheel in a cart, and in comes a telepsychiatrist. So you have the availability to meet with a psychiatrist, and they'll set out a treatment plan. And sometimes folks will qualify for care in our facility. We have a 14-bed behavioral health department upstairs, and we treat only adults. And so we don't have the capacity to care for adolescents or geriatrics, but anyone who's an adult needing care can certainly receive it in our department. And so that's one of the services that sets us apart in our community. But what I was saying before is how do we go about recovering and being kind of a leader in the community when it comes to the drug addiction crisis that we have in this community. And so we had the opportunity to be introduced to a group out of Des Moines Well, they have we signed on with a group that has something called the Billion Pill Pledge. And we signed on to the Billion Pill Pledge in the late summer of 2023. And what we've done is partnered with Blackfinch is the name of the company, now that it's come back to mind. And they helped us take a look at our protocols in our operating room. And there is a protocol called Enhanced Recovery After Surgery, which is called ERAS protocol. And we encourage folks to drink a clear liquid before surgery that's high in carbohydrate content, and to take some over-the-counter medications like ibuprofen or acetaminophen. And it's shown that when folks do that, that their need for opioids following surgery is significantly reduced. And many of our surgeons were writing for 60 opioid medications after surgery. Because of the success of this program, we have some surgeons that are not writing any opioids after surgery, and we have some that are writing that have gone from 60 and are down to 20.
That's awesome. Is that being received fairly well by the people who are being served?
It is. In fact, since this summer of 23, we have not had any emergency room visits because of pain. We've only needed to do a refill on an opioid, I think maybe twice.
That's
to this
awesome.
point. And so folks they're receiving the surgical care that they need, and they're not having to rely on opioids like they have historically. And they're not having the pain. And so it just shows us that we can do things a little bit differently. And this is a very high-level view, obviously. When you come in and you talk to your physician, your surgeon, and the nursing staff, they'll give you much more information related to this. And at the end, we want our folks to have the surgical care that they need and to not have pain. But if we can do both of those things and not prescribe opioids and put more opioids into the community, then I think that we can all agree that that's a win-win.
Oh, absolutely it is.
Because we know that many times, especially the elderly, will have mini surgeries, and at times they have loved ones that will come over to their home to visit, and then they know that grandma or grandpa or mom or dad may have opioids, and they're raiding medicine cabinets and getting access to drugs that, one, have street value, two, that can make someone dependent on an opioid for the rest of their life. And so anything that we can do to reverse that trend, we were very interested in doing, and I would say that we've been very successful in this program, and I think that helps make Ottumwa healthier.
Oh, yeah, absolutely it does. I want to switch gears with you just a little bit,
Sure.
Going back maybe towards the beginning of the conversation, but then kind of jump forward to something a little bit different. One of the criticisms that Ottumwa Regional has had in the last few months, especially since the news broke, has been that they're the only for-profit hospital in the state of Iowa.
Right.
And while that seems to be an issue to some, it's, at least from what I have seen, it's provided a little bit of an opportunity and investment and things like that. And then it's also afforded some opportunity to bring in some new leadership into the hospital. Would you mind talking about that just a little bit?
Yeah, it's a great question. I appreciate that. We, as I mentioned at the beginning of the conversation, we are owned by our parent company, it's LifePoint. And LifePoint operates over 100 facilities across the nation, from coast to coast kind of thing. And we have over 60 acute care hospitals like Ottumwa Regional. And we really operate primarily in a rural or small community space. And we do have some larger hospitals, but this really is our niche. And because of that depth of having so many facilities, when this event occurred, I was actually living and working in Arizona at the time, and I got a phone
Where my
call.
brother lives, actually. We had that conversation.
That's right. Same community. And because, like I said, because of that depth of leadership and experience across the nation, they were able to pick up the phone, give me a call, and said, "We need you in Iowa in a week." And so here I came. And my job has been to stabilize the organization, because we've obviously the death of a provider and then the issues that came after that have really rocked the community, have affected a lot of people, and we're mindful of that. We want for folks to trust in their hospital here locally. We, like many other folks in the healthcare industry, have a lot of challenges, and this only added to those challenges, right? But when I started, I quickly realized that some changes needed to be made. To be able to get an organization the size of ours, so we have between 450 and 500 employees, to be able to get us where we needed to be, it was going to take making some changes. And so I have a completely new executive team. I'm a new CEO. I've been here 15 months. We have a new CFO, a new chief financial officer, a new chief nursing officer, and we've made quite a few changes to our director level leadership group. And some of those people have self-selected out. Some people have retired, others have needed to move for family reasons, and some we've had to make some decisions and say, you know what, we just need some new blood in the organization. And so we have a new group in, and I feel that we are in a better place with our leaders so that we can continue to grow and position ourselves to grow into the organization that Ottumwa wants and needs us to be. Mm-hmm. And I think that I've gone around, I've given a report to like the Rotary Club and to some other groups, and then also in November I had the opportunity to give a report on Ottumwa Regional to the City Council. And I think that folks will find that I am nothing but transparent and very cognizant of the challenges that we have.
Sometimes shockingly transparent.
Yes. We are very aware of the challenges that we have. Trying to play it off and pretend that they're not there does no one any good. And I think I want the community to know that from the CEO perspective of the organization, I am fully aware of those challenges. Working to improve those and to fight against those challenges that we have regularly. On a daily basis, in fact. And I think it's important that the community knows that.
Well, and it's really interesting because for an organization that's, number one, as large as Ottumwa Regional mm-hmm. is, and then you have a lot of regulation in place that people on the outside don't necessarily get to see. And then when you couple that with making those changes at a high level, which again people don't necessarily right. see, things move maybe a little bit slower, or they're not as out in the open as what people might want to think that they could be or should be. They don't see things happening, but they actually are in fact happening. Right. And ultimately that's going to make the place better in the end.
Absolutely. It is. I can understand from a community standpoint, frustration. You want to have a great hospital. You want to have healthcare that you can trust in. And then a really significant, terrible event happened a little over a year ago. Well, what's going on? And folks that are not involved in the daily operations would not be aware that all of these changes were made, and that we make progress on a daily basis, and we're committed to that. And happy to come. I'll make the invitation to anyone hearing. I'm happy to come and speak to any group. If you lead a group or if you participate in a group and you'd like to have an update from the hospital, happy to come out and to touch base with you or your organization, because this, like I've said a couple of times already, and I think it's so important, folks in a rural community, in every community, they need to have healthcare they can believe in and that they can trust in. I don't want folks driving past our hospital when they're having a serious emergency. Because there's long waits in our emergency department. We do have long waits from time to time in our emergency department. And the truth is that we have a higher volume here than the smaller hospitals around us don't see. And so that at times creates wait times. And not only do we have more patients coming to our emergency department, we have a higher acuity because we have more subspecialties. And so if you're having a heart attack, if you're having a stroke, if you've had a traumatic event, don't think twice to come to us. We triage our patients. You will get in to be seen. You will get great care. We will do great by you. If you're not having a true emergency and you come to our emergency department and others are, that forces you to wait because we must triage the most acute patients first.
Well, and I think that that's one of the problems, and I don't think that this is really unique to Ottumwa Regional at all, that everybody's emergency is their emergency, right, and they believe that that is the most important thing. But to your point, a heart attack is clearly more important than somebody that has a steady cough.
Right, or a need for stitches even. It's true. Everyone's emergency is their emergency in that moment. But trust that we have qualified physicians and nurses that are putting the right people at the front of the line. And I know that's very frustrating, and we are continuing to do things to make improvements on that. We're not all the way there. There's a lot more that we need to do. One of the things I talked about before was recruitment. We have the need to hire lots of qualified medical professionals here at our facility. And so if you're one of those, and if you're hearing that, or if you have a loved one that is a medical professional, we need them in our facility. We very much want Ottumwans taking care of Ottumwans. And so we have put our money where our mouth is. We've done significant rate increases for a good swath of our medical professionals at this point, and we have very significant sign-on bonuses, starting at $5,000 all the way up to $35,000, with half of that being paid within your first 60 days. And so we very much want to bring the best from our community and the surrounding communities to take care of the folks from this community. We want Ottumwans taking care of Ottumwans.
And that's really a good segue. We've talked a lot about the past, and nothing can be done about that. But what can be done about is what the future holds. Absolutely. For Ottumwa Regional. So let's talk about that for just a second. I know that there's been new core values that have been instilled, right, at Ottumwa Regional. And how does that play, or first of all, I guess, what are those core values? And then how does that play into what you and Ottumwa Regional itself sees for the future of the organization?
Sure. So we rolled out 5 new core values, and our mission, just so that everyone knows, is to make the community healthier. So specifically in Ottumwa, it's to make Ottumwa healthier, right? And I've spoken to that a little bit. And our vision is we want to be the hospital where people want to receive their care, where medical folks want to work, and where providers, our physicians and our mid-level providers, want to practice medicine. And then we have values for all of our employees that feed up into that. And I'm doing this so that you guys can't see me, but I'm doing this all off the top of my head. And the reason why I can do that is because we touch these on a daily basis. And so we have 4 core values, like I said. One is, see if I can get these all done off the top of my head. The first is that we will champion patient care. We will act with kindness. We will embrace individuality. We will make a difference together. And I usually get to 4, and then I struggle with the 5th, and it's never the same one. Did I say that we do the right thing? I'm not sure that I said that. And so we huddle as a leadership group on a daily basis at the hospital at least once a day, and we always have a mission moment where we try to point out members of our team that are exhibiting core values, and it's almost daily that we write thank you cards there on the spot for our employees. And because of Snowmageddon that we just went through, this morning we were having our morning huddle, and I think I wrote, between 10 and 20 thank you cards for the exceptional things that lots of people did to continue rendering care through the challenges that we had. And then we expect that our departments, every department on a daily basis, that they huddle, and they're supposed to be talking about core values on a daily basis so that they, at the department level, can point out the individuals that are going above and beyond, that are exhibiting the core values, so that we can set that as the standard, because we want everyone to receive the best patient care that they can when they come to Ottumwa Regional. And so that's in part what we do on a daily basis.
Okay. So I know that you've been getting out into the community. Community involvement has taken a shift from Ottumwa Regional from, where it was 2-3 years ago to where it is today. One of the big things that we've been at GoPip have been very vocal about is the fact that you come on board and all of a sudden we can get the St. Joseph property back in the hands of the community of Ottumwa. There's been other projects working towards a daycare solution.
Correct.
Can you talk just a little bit about how your theory of community involvement has changed the face of Ottumwa Regional over the last year?
Sure. And it's, I'll say, if I say please understand that I represent the entire organization. I represent my director group. I represent my executive team. And so we've come together and we've had much discussion about this in our strategic planning. And we're a major employer of this community. We are in this community. We're Ottumwans, right? And so we want to serve the community of Ottumwa. We want our employees, we want our directors to be on local boards, to be participating in their churches, their children's ball teams, and to also be promoting the organization as they do that, because that is where they receive their livelihood from. And we want the community to know that we are a part, that we represent a good component of this community's employment base. And we are the place to come for your health care, for acute care services. Of course, there are a multitude of other organizations that render different services in healthcare, but if you're acute, this is where you come. And so we don't take that responsibility lightly, and we want to make sure that in a community this sized, this is going back to Ottumwans taking care of Ottumwans, folks should see their providers in the community. They should see their nurses in the community, their phlebotomists, their receptionists, and so on and so forth. And that is, I guess if that's a shift from where we were before, that's very much what we want it to be. I'm a Rotarian in the community. I serve on the GoPip board. And as a part of that, I have responsibilities. I had a responsibility to move that piece of property back into the hands of the community where it needed to be so that it can be developed. And I take my role very seriously, and I worked with other individuals in LifePoint to ensure that could happen. And you, along with I and many others, made that come to fruition, and we're proud of that. Mm-hmm. And we want to be, when there are walks, we are present. When there are different community events, we're getting better. We're not to where we need to be yet, but we will continue to grow so that we can be an active member of the community of Ottumwa.
Well, one of the things you keep saying, Ottumwans helping Ottumwans, and it reminds me a few months ago, I don't remember how long ago, you can probably tell me, I was privileged enough to be invited to one of your employee anniversary events, and it's rare anymore that you get to see employees celebrating 25, 35, and I think that there was one that was 45 years. Yes. It was really a testament to me about the employees that are working at Ottumwa Regional, that they're willing to dedicate really their entire adult life to working at that facility, and how much they truly care about being attached to Ottumwa Regional.
It's remarkable. We have so many folks that have worked at Ottumwa Regional for so many years. And this is my call back to those folks who have left for any reason. I recognize that it maybe didn't have the best culture. I recognize that maybe there were things that were not the way they should have been. And we're working tirelessly to get the organization back to what it once was. The hospital at one point, I think, was a hospital that people were very proud of, and we are working very hard, like I said, to get it back to that point. I very much, it's my goal, and many other employees' goals at the organization, that people would not think twice to come to Ottumwa Regional. And I read our reviews, and I'm very cognizant of where we are today. I know that that's not always the case, and trust me, that pierces us to the very core when we hear a negative review. And we work very hard to figure out, why did this happen and how do we prevent it from happening again? But it's going to take the community to make this hospital what it needs to be. I can report to you today that about 80% of our clinical employees at this point are contract labor. They come to us from not only around the state, but from around the country, and are providing services here. And so if there are Ottumwans who are nurses and LVNs and phlebotomists and radiology techs and every other thing that we employ, plant operations, finance, there are so many types of individuals that we employ. If you're working somewhere else, I challenge you to give us another shot, and come back and work in Ottumwa and help us make Ottumwa Regional the organization that you would want to bring your family to.
Well, and there are more opportunities now than there were in the past. Recently you guys opened up a cath lab. We were out there lucky enough to be there for the ribbon cutting for that. It was like $4.5 million. Is that correct?
That's correct.
So that's just another service line that's opened up for this for the hospital.
Yeah, and I'll take this back for a second to your comment before about for-profit, non-for-profit. I'm not sure that everyone is aware of this, but the designation it is simply a tax designation, right? Non-for-profits, they take the money, if there's money left over, they reinvest in their organization, right, with that money. And they pay no taxes. And so every other hospital in the state of Iowa at this point, that means that there is a tax base that supports them. And I've been the CEO of a tax-based supported hospital, and I received about $2 million from my taxpayers to help me run my hospital. Well, in this community, the taxpayer does not pay any tax. None of their tax goes to support their hospital. In fact, we pay millions of dollars worth of taxes that go back into the community to support roads and schools and everything else that comes along with that. And guess what? We also take money and reinvest it into the organization. However, we don't make money at Ottumwa Regional. And in fact, we have shockingly multi-million-dollar losses at this organization. And that's part of what I'm sent here to do too, is to fix that, right? And we need better control at the local level to ensure that we are not expending resources inappropriately and that we're making the very best of those resources. And I will tell you that historically, there was a culture at the organization at times where folks tried not to take patients. We found reasons to not admit folks locally.
I believe your behavioral health might have been one of those departments.
It may have been. And there may have been others. And I will freely admit that, right? And I'm here. As the CEO of the organization, I can say we want to take care of every patient that comes through our doors that we have the capacity to safely care for. And we've had to fight a little bit to get back to that point because historically, that's not always been the case. And we've had to help people understand why we need to work harder. And we've also had to depart with some folks that that was not consistent with their feeling about what their work environment should be. I think that everyone should work very hard every day when they come to work. And we are dedicated, and we should be dedicated to the care of the patients that need care from our community. Anytime anyone leaves our community to receive health care, it should be because they need a higher level of service or a higher level of care that we don't render at Ottumwa Regional today. But to your point, we just opened a new cath lab. It is state-of-the-art. You can't get better equipment if you were to go to Des Moines or Iowa City. Or to Mayo for that matter. And now what we need are more employees to run that state-of-the-art equipment. And we need some additional providers so that we can run that service more frequently. But that is just an example of $4.6 million that LifePoint spent in Ottumwa so that Ottumwans can receive top-notch care. And that wasn't purchased by Ottumwans because your tax money is not going into our facility. that was purchased by our parent organization that was put in here. And so it's important that folks understand that. And if I can segue off of that, if
Sure.
you don't mind, I'll talk about EMS services really quick. Unique in my almost 20 years of healthcare is I am running EMS services for the first time. Most hospitals don't do that. I think it's maybe a little bit more common in Iowa that occurs. I'm a Texan, and in Texas, it's almost exclusively that third-party folks run ambulance services, or the city or the county will do it, right? In Ottumwa Regional runs that service. And historically, we've been able to operate that service in the black, so it's made some revenue. For the last several years, we've lost money running the service for the community. We're happy to do it because it needs to be operated, obviously. If I have an accident, Mark, if you have an accident, an ambulance needs to show up there, right?
Hopefully, anyway.
Absolutely. And Ottumwa Regional has proudly provided that service for decades. And at first, Ottumwa Regional was a independent, non-for-profit, and it's transitioned over the last years. And so I know that LifePoint took over and at the end of 2018, so 2019 forward, and it had for-profit owners before that. I think stemming back to 2010,
That sounds about right.
If I can pull that date accurately, I think it was 2010. But LifePoint since 2019, basically. And like I said, we've been operating at a loss, and then last year at a significant loss because of the constraint of resources, because of the need to increase wages and the pandemic, everything that's happened to the world. And I think healthcare we've experienced it even more acutely. Our rates for paying folks we've had to dramatically increase them, and EMS services is one of those. And so we actually continue to operate EMS services here in Ottumwa and in Wapello County, losing more than $500,000 just last year alone. And so when people say, oh, there's the big bad wolf of being for-profit, not so much. We continue to operate the service at a loss because we want to render good health care, and we want 911 calls to not go unanswered. And we're working with the mayor and with the board of supervisors to look at this service on the go forward. But we are committed to continuing to provide this service.
Great. So are there, speaking of providing services, are there any future plans for new services that Ottumwa Regional doesn't currently have?
We continue to look at that. And we have a recruitment arm of our corporation that is constantly having physician conversations. And in healthcare, when you open a new service line, that is often tied to a new provider or a new contracted provider. And many of you may know that we've had sleep medicine for many years. After the pandemic, we had some challenges with staffing that, and we basically have not been providing on-campus overnight sleep studies for quite some time now, over a year. And we have been working hard to find a contractor who could come in and provide that service for us. We just, in the last week or two, have signed a formal agreement with an outside corporation, and with that corporation comes a medical director. And so in the very near future, we have some stand-up things that we need to work through. We have some new equipment coming in, some new employees coming in, but we're going to be able to offer on-campus overnight sleep study services. That's not fantastic. Just home sleep tests, but on campus. I would say as soon as February the 1st. And so we're excited about that. And we continue to recruit, right? And so we are in long conversations over the last 6 months with a general surgeon. He does surgical oncology. And so that would be a brand new service that we would add. And so let's say that we have a female who has breast cancer. Historically, if she needed to have surgical procedure related to our breast cancer diagnosis, we could not do that here in large part. If we're able to recruit this gentleman, we would be able to do that here in Ottumwa. And then if she needed radiation therapy services, we can do that here in Ottumwa. And what we would be missing are the infusion services for chemotherapeutics. We don't do that here today, and maybe the medical oncology component of that. But we have the rad-onc, the radiation therapy that we can do. If we bring in a surg-onc, then you can see how we can look to partner even further with, like, the University of Iowa to bring in medical oncology, and then we can round out an entire surgical an entire oncology service line here in Ottumwa,
Which would be fantastic.
Absolutely. And so we constantly look at what services are needed, how can we bring in more professionals to render those services. We're having some discussions with an OBGYN who was in the community for quite some time a while ago, and is looking to maybe move back to the community. And so we are in contract negotiations with that gentleman now. And so if you'll all cross your fingers collectively with me, we'd love to get him back. And then we even have some other subspecialists that have reached out in the recent past that we are trying to negotiate with to, again, broaden the scope of the services that we can provide here in the community.
Awesome. Well, we've covered a lot in a
We
really
have.
short amount of time. Is there anything else that you'd like to add before we sign off?
No, I want the community to know that we are working tirelessly at Ottumwa Regional to improve services, as I've mentioned, to even grow them at times. Be patient with us. As the organization has gotten to the point where it was, that doesn't happen overnight, and the cure or the fix also does not happen overnight. And so we are all in. We are going to continue to make improvements, and we are invested in your healthcare just as you are.
Awesome. Well, thank you, William, for coming in.
My
and
pleasure.
Everybody, stick around for the next episode of Talk Ottumwa. Greater Ottumwa Partners in Progress would like to thank the following Signature Circle investors who help us deliver on our mission to advance the prosperity of the Ottumwa region. Cargill Incorporated, Seafirst Credit Union, Elliott Oil Company, John Deere, McCune and Reed Insurance, Ottumwa Regional Health Center, the Ottumwa Legacy Foundation, South Ottumwa Savings Bank, City of Ottumwa, and the Wapello County Board of Supervisors. Please visit www.gopip.org to keep up on community events, podcasts, and everything Ottumwa.